Take it away, Jeff.
Good afternoon. This is Jeff Weinberg with Caregiver Champion. And in our series of videos that we're doing on people who have tremendous backgrounds, I am pleased to announce a very important person who has recently become part of my team as a concierge physician. And we've had many medically complex people, and even though I've had a nurse on my staff, I felt that it was time that we brought in a physician. And I've been looking for a couple of years, and I have been very fortunate to have Dr. Lisa Mainier, who is an integrative physician and a concierge physician. And she's going to talk a little bit about what she does and how she does it and things like that. So I'm going to turn it over to Rachel and Lisa. Thank you for coming. I appreciate it.
Oh, thank you so much. And also thank you for that wonderful introduction. That was very kind of you. Thank you very much.
Yeah, thank
My
you for joining
pleasure.
us.
It's all true.
Why don't we start out by you telling us just a little bit about your background, Lisa?
Well, rather than give my whole CV, who wants to take a nap today, right? Let me just start, right before medical school, because before I became a physician, that's where I did most of my major learning. I started as my undergraduate degree was in pathology, so I was able to see things from a cellular perspective that only grew as I went into my careers, and gave me a special perspective on how the body works from a cellular level, and which really helped further. As I grew older, I got into some administrative positions and took got some degrees in administrative healthcare administration. Wasn't a big fan, but I did become a healthcare risk manager. And I learned a lot about legal issues in medicine that way, how to chart effectively. But that was really to help other physicians at the time. I always wanted to be in clinical medicine. As a matter of fact, I don't know if anybody there remembers Quincy, but I always wanted to be a medical examiner. I used to watch Quincy when I was younger.
I do remember.
Do you remember? I wanted to be a forensic pathologist, but by the time I grew up, I did become a physician assistant and worked in orthopedic surgery for years. My previous husband and I had our own private practice in West Virginia and Ohio area there. And I'm telling you, the pathology there was so much more intense, but the practice enabled me to help people actually get better by saying, listen, you've got these medical issues. We can replace your hip or your knee or whatever, but before we do that, you have to understand, you've got to lose some weight or you've got to do this. And some of the patients took our advice so seriously that they lost so much weight that they didn't have to have surgery.
Wow, imagine that.
Right. So we were so busy, we didn't have to do surgery on so many people. We did it on the most severe pathology, and there was a lot there. So, but the great thing about that was we were able to see such improvement in the quality of life in so many people that just inspired me to go further. And of course, I always wanted to become a physician. So when I did become a physician, those things that I picked up in orthopedic surgery, I carried into my clinical practices.
Amazing. I love that. I love when people talk about the preventative rather than
Absolutely.
It's really great to hear. Well, you answered my second question on why you decided to become a doctor, I guess.
Well, let me explain that. When I was a little girl, I think I was in 3rd grade. I mean, I was very young, and now looking back, I was pretty precocious, but I didn't know that at the time. But I was just so
You're still precocious.
I was really into bugs and you name it. When the summertime between like 4th and 5th grade, I asked for a microscope and chemistry sets, but I got a microscope and I learned how you could just set a jar of like grass and stuff from your yard and grow bugs in there and then look at them under your microscope. I mean, that was so exciting for me. But what really piqued my interest was in 5th grade when we started learning real science, biology, and that included the systems of the body. I was just enthralled. I couldn't wait to get to school. Today we're doing the respiratory tract. Next week we're doing the digestive tract. And listen, it was really basic, but it was just so exciting to me. I was amazed at how the body could work. And I'm still amazed to this day. I still find the human body, the way it functions, so intriguing.
How old were you when you started getting interested in it?
I would say really maybe anywhere between 3rd and 5th grade. It was such a gradual thing, but I always had a penchant for science and how things worked, and specifically how nature worked, because there is no substitute for nature. You know, Apple, Microsoft, they're all so great at their technology, but it does not even compare
Absolutely.
to how the body works. We haven't even touched all the things that the body does. So, and I do respect that. Even to this day, I still respect that.
That's cool. That's well put. What is the difference between concierge MD and a regular MD?
Well, I'm a DO. So by the way,
Okay.
there are 2 kinds of physicians in the United States, and one is a medical doctor degree, and the other one is a doctor of osteopathic medicine. And basically what that means is we learn medical school, the exact same medical school, but in addition to that, we do osteopathic manipulative medicine, meaning we try to remove the physical restrictions to the body's healing. And that really is true. So, you know, when somebody says to me, well, you know, how can my neck pain be related to my indigestion? And I tell them that sometimes it's not really indigestion. It is, you know, contractures and problems with the neck that's causing the indigestion. And they say, well, how could that possibly be? And I explain to them that the somatic or the musculoskeletal nerves that innervate muscles and things run alongside the visceral or the organ nerves. So when one of them gets upset, the one right next to it gets upset. So relieving the stresses in that area can actually relieve the visceral or the organ issues at the same time. So, you know, it allows us a different perspective. So the difference between concierge and regular medicine doctors, well, really, it's hard for me to explain that. The real question is, what's the difference between the kind of medicine that I practice and the kind of medicine that you know, and I'm a regular doctor, but I chose to get out of the insurance-based, protocol-driven medical care because that is what it is. It's medical care. It does not really, the perception is there that it does, but in reality, I look for people to become healthy. And becoming healthy is a different pathway, a different discovery. And that pathway, to me, is what a lot of people are looking for, but think they're getting in the medical world because their symptoms are gone. I have a lot of patients say, well, I don't have, when I'm asking history, well, I don't have hypertension. Well, you're on 4 different medications. Well, that's why I don't have hypertension anymore. They still have hypertension. It's just being looking better because they're on 4 medications. I mean, 4 medications. So somebody didn't get to the bottom of that. And that's what I do. I dig deeper to find out, why is your blood pressure off? And we learn in medical school, it's just because. And it's called essential hypertension. And sometimes there's reasons behind that. So before
I want to interject something.
Yes.
I didn't mean to interrupt you though.
That's right.
Okay. What Lisa just said is crucial to not only what she does, but crucial to what we're being able to offer because of what she does. The average doctor today spends 7 minutes with their patient. most of the time is spent with a nurse practitioner, and I'm not saying that they're not
Right.
good, because they are excellent. However, everything that doctor does is insurance driven.
Mhm.
And if they can't find a diagnosis to fit some kind of diagnostic code, they can't do it.
Right.
So Dr. Lisa has the ability to be independent of that insurance
Mhm.
company's restrictions and demands. And that makes the world of difference. It
It
really,
certainly
really
does.
does.
Certainly
It's,
does.
no, I think that I, I just, I'm amazed every time you talk. And I am.
Not
Uh,
everybody would say that.
Well,
and I
I am
always
too.
learn something.
I am too, and just
Uh,
that I wish this was more of a conversation in mainstream
Okay.
medicine as well, especially as we're all talking about COVID and all of that, which we'll kind of
Absolutely.
get into here with this portion. And I think a nice segue into what you just were talking about with the preventative aspects is your focus on healthy eating and nutrition. So
Mhm.
I'd love to hear more about that and, why you put an emphasis on that. And does this replace medicine?
Right. And, healthy eating, nutrition, those are just part of the recommendations that I make. And of course, our bodies work with nature and nature works with our body. And there is no denying that. You cannot substitute and you cannot ignore it. So usually our bodies go awry because we're not following nature. We're eating foods that are manufactured, mass farmed, mass produced, GMO, farmed fish. I mean, the foods that we're eating and putting into our body, and it is very true. I know it sounds cliche, but you are what you eat. If you're eating refined flours where they grind up the germ layer, throw out all the nutrition and save you the powder, the stuff that really should have gone thrown away, and that's what you're eating, you're getting sugar. It just looks like a form of bread, but it is sugar. If you're eating fake fats such as trans fats, which is shortening and margarine, things like that, you're putting into your body fats that are synthesized. They're not real. So your body can't handle it. It doesn't know what to do with it. And so it just starts destroying things. It's what those fats are is a foreign body. So your body starts trying to attack it in your blood vessels, and that's where you get damaged. So that's it. That's an example. But certainly what you eat is what you are, and what you're putting into your body can cause damage. That cannot be ignored. So yes, I definitely do nutrition and counseling in that way. And I am a full believer in the Mediterranean diet. I'm a full believer in that plant-based, not vegan necessarily, but plant-based foods. The less processed, the better, are what your body needs to stay healthy. It needs it to stay healthy. If you're not getting lycopene, if you're not getting folate, folic acid is different than folate foods, but if you're not getting those from food sources, magnesium, potassium, then you're going to have high blood pressure. You're going to have endothelial, or the inside of the artery, damage causing atherosclerosis. You're going to have heart attacks. You're going to have strokes. Those things will happen because the body is running for quite a long time. You can get away with it, but it's running on the wrong things. They are not fuels. But also what I incorporate into my practice is a complete lifestyle, such as activity, nutrition, meditation, mind-body approaches, because what are we all dealing with right now but stress? If you do not believe that there's a connection between the mind and the heart and the mind and the body, you are totally missing a huge piece of healing. Not treatment, but healing. The body can heal, but unless you're treating it right, it can't heal. And that's what we really miss in in our traditional insurance-based medical care. It's not about healing. It's about silencing those symptoms to get you out of the office. So, and that billing code and all that billing gets right to the front desk before you even check out. Okay. But what my patients are doing is learning all over again how to eat, how to behave activity wise, how to handle stress. You certainly can't eliminate it all, but learn how to handle stress, what it does to the inside of your arteries, your brain. And also, we may incorporate some supplements, and I will use medication in some instances, but that's not my final solution. The final solution is, while we're waiting for these cholesterol levels to come down or for the inflammation to come down, while we're waiting for that, let's do these medications for at least a couple of months. Give me a couple of months, because you're not having a heart attack on my turf. So yes, I am using it, but that is not my final solution. There are things that we can do before the lifestyle measures kick in, and it's pretty fast. The body is pretty darn quick, and fortunately, I have a lot of people who are being proactive rather than, I've had 6 heart attacks and a stroke and diabetes and my toes have been cut off. Can you help me? It's, certainly we can improve things in that situation, but I'm getting people who are saying, I don't want that to happen to me. How can I take care of myself now? What can I do? And even though they're, this is a, cash pays practice, they're saving a ton of time and money and suffering down the road.
That's the huge issue, and people don't understand that.
Yeah.
But it's like, there used to be a commercial, it's like, you can pay now or you can pay later.
Yeah.
And in your instance, it's the same thing. But to go back a step, the average elderly person is on somewhere between 12 and 15 medicines a day.
Right.
And I'm sure with someone like you, you can reduce that greatly, at least in terms of being able to augment some of those medicines with your holistic approach to care.
Right. And, and we may be going off a tangent here, but once people are on certain medications, it's very difficult to get off, because you're usually inhibiting a natural process, which goes, oh my gosh, I'm going to kick it up a notch because I need to make hydrochloric acid in the stomach, for instance. And when we give people a proton pump inhibitor, which is, Prilosec, what's the other, the purple one, the Nexium, those kind of things, which are now over the counter. When you aim to cut off something that should be there, and it's there for good reason, the body tries to kick it up so that when you try to get off of that, you're going to get worse. So it's very difficult to get people off. You have to substitute. You have to do it gradually. The same thing with antidepressives, worse with beta blockers, worse with Xanax, anti-anxiety medications. And there are ways to decrease that without, going to long-term use of Xanax and those benzos to calm people down from anxiety. That's not a lifetime solution. That's maybe a quick solution if someone hasn't been seen, but it is not a solution.
Right.
My experience has been that in working in a hospital or nursing home, is that a lot of the meds people are on are duplications of other meds that they're on.
Yes.
And I think one of the issues is that healthcare today is fragmented. And so the primary doctor puts someone on one medicine, a specialist puts someone on another person, and another specialist puts someone on a third medicine. And they could all be probably the same, but no one talks to each other.
No one does. That is the job of the PCP, to be the coordinator of everybody, an astute one anyway. And an even smarter one says, hold on a minute. What are we doing here? Let's all get on a conference call tonight. Now, do they have the time to do this? Well,
No.
It is set up so that they do not have the time to do that. And I'm sure a lot of them would like to. However, the new ones coming out of training now are never going to do that. They're never going to know that you can do that. They're never going to understand the coordination. It's everybody just keeps their blinders on, keep going straight ahead, keep getting your numbers up, because you are threatened with numbers when you're in the insurance-based practice. Numbers have to be up, RVUs have to be up, that is a true thing. So when you're paying off $400,000 in medical school loans, you do what you're told and you do what you have to do. But, you know, I digress here, but the main problem that we're getting to is, why are all these elderly people on so many medications? Well, basically what you're doing is treating side effects of the medications.
Exactly.
You know, and it just takes somebody using cognition instead of rote memorization. And, you know, when we talk about nurse practitioners and PAs, I have nothing against them, because I was one once, and my daughter is still a PA and she's an excellent one, but we train them to push those buttons, because their education, you know, tells them, you know, press this radio button here for this ICD-10 code, and this is the corresponding medication. There's never a thought about, can this patient take it? Did I get enough information? Did I hear her story? Does she have family members that have not been able to handle this? And what does her body function? How does her body function? And those are questions that I ask in my practice. Certainly, I'm not going to put somebody on a statin if they have, you know, problems with, you know, myelin sheath, you know, the fat that lines your nerve cells. If there's something in the family history, I'm not going to do it. You need that fat. Okay. So we're going to look elsewhere to treat, you know, heart disease. So those are the thought processes that don't go into treatments anymore, that should be there. And that's why it's okay to replace physicians with mid-level practitioners, because we've gotten out of thinking going up and above and beyond what we should be doing. So they're awesome physician extenders, but now that we're replacing physicians because it's faster, easier, and cheaper, we need to start thinking about that. And patients need to say, listen, I went to come to see the doctor and I haven't seen my doctor ever. And I've had patients say that. And the law is, after 3 visits, you need to see a physician assistant. If you're not, you need to say something. And you need to say something when you're making your appointment. Who are you seeing? Who do you want to see? And some people would prefer to see their mid-level practitioners. Nothing wrong with that. But I think what we need to do is ask. Be proactive in your own health. Who am I seeing? What are we going to talk about? And how long do I have? This is what I want to talk about today. I've noticed that when we're going to a physician's office, it's self-populating HPI. The HPI is the history of present illness that the physician should be gathering. They're not. You're answering it, and electronically, on an iPad when you're sitting in the waiting room, and electronically it goes into the medical record. The doctor's not asking the questions. And when they do, it's a one-word answer, yes or no. Do you have pain and swelling? Yes or no, on a number. But, to allow patients to, elaborate, it's just been stop. We don't have time for this. Just get to my answer so I can get you into this category.
And many of these things that you're describing are things that Jeff, as a patient advocate, will help, direct a patient to the right resources like yourself.
Yes.
So this is such a great conversation
Right.
because of that too.
Right.
For people who feel overwhelmed and aren't sure about which questions to ask. So
Right.
I think people have to start to understand that when they go to the doctor is not all be all, and they should just listen to whatever's said without questioning.
Right.
In fact, it should be the other way around, which is the doctor needs to take time with the patient.
Absolutely.
And answer the patient's questions. And
Right.
people need to prepare, like you said,
Right.
going into an office visit as to what they expect.
Right. And tell the doctor before he begins or she begins introducing, say, this is what I would like out of this appointment today. I just want to know this, or I'd just like to know this. And that may actually help the physician, because they really truly do only have 10, 12 minutes. And half of that time is spent documenting, so that before you leave that office, that billing information is in there. So I think you need, if people choose to only see that kind of physician, then they need to be proactive and have somebody who can help them navigate that office visit, or even making that appointment for the, making that appointment and discussing that before they go into the office.
Yeah, absolutely.
The other piece to that is it's not just in the office, it's in the hospital.
Oh gosh, yes. We're
I
not even going to go there.
well, I just
We
want to
are
say
running
one thing.
short here.
We don't have enough time, but
Yep.
I had a client who had a very tragic thing happen to him,
Right.
and he was in a hospital,
Mm-hmm.
and every day I had to retell the story to whoever was taking care of
Yeah.
him.
Nobody's reading notes. Nobody's communicating.
They did a wonderful job that day taking care of him, but nobody knew what was going on with this gentleman.
Right.
And I even brought it to the supervisor, and I said, why aren't you writing like a ongoing
Note.
note? Right. And again, it was we're too busy or this and that, but we don't.
Well, it has to do with electronic medical records. There's
And that's it.
pre-written sentences.
They don't have time to read it and pull
Yeah.
it up. But it was really like Groundhog's Day every day.
Yeah. Yep. Mm-hmm. Yep. Been there, done that on both, on the side of a patient, consistently.
Yeah.
That is the standard of care, which is acceptable. So.
And people need to understand that as well as how to go to the doctor, because again, the doctor walks in, how are you feeling? That's good, goodbye. And they aren't getting the information that they need from the doctor or anybody else that comes in.
Yeah. So we're coming close to the end here, and before we want to let people know where they can find more about you, would like to kind of take the conversation to COVID-19 and what you've noticed about it, how it affects your patients, and if there are any preventative measures people can take, to stay healthy during this time.
Well, basically, this virus is getting those people who are not in optimal health, and sometimes we don't know that. But COVID-19, the toll that it's taking on a lot of people is actually more mental. It has mental and emotional. People are in order to protect themselves. There's a lot of fear out there. There's a lot of fear-based guidelines and rules going in, and what it does is it cuts off the human being from being human. So we're not allowed to look at each other more than 6 feet. We can't read people's lips, expressions. We aren't allowed to stand near them. There has to be glass between us. We can't touch people. We can't touch things. I mean, it's becoming an inhuman world, and because that is part of humanity and health, we are seeing a lot of issues with mental health, even heart attacks, strokes. There's been an upsurge in heart attacks and strokes because stress causes inflammation. Inflammation causes disease and acute ramifications of that disease. So when you say, what can we do? Try to stay as social as possible through social media if you can, but if people are safe in your home, you still need to be able to communicate with people and your family members. So, I don't want to keep us waiting here and talking about what else can you do for COVID-19, but really being tip-top, healthy, immune system, healthy shape, that's what's going to save you.
Yeah. Well, this has been such a great conversation. Where can people find out more about you? How can they connect with you? Possibly even, work with you?
Right. So my main office is in Erie, Pennsylvania. However, I do see people. I can come to their homes in the Pittsburgh area. My website is drlisamainier.com, and it's DRLISA, M as in mother, AIN as in Nancy, IER.com. And it used to be Italian for Mainiero, which means, I think that's like a fisherman, somebody of the sea. Mainier, so like the sea.
You're kind of a fisherman.
So it's drlisamainier.com is my website. It is undergoing construction right now, but it's still up and running, but it's kind of the old version. So I can be reached there. I also have a Facebook page, and my phone number anywhere I can be reached at 814-923-4025. Call in and say, hey, I heard you said this, and I heard you said that. And what I do is I incorporate lifestyle measures into health, but I also do osteopathic manipulation. I do nutritional counseling. I also do medical acupuncture, but I've been limiting that a little bit in my area just because of my office setup now. But all of those things are necessary, and different people need different things for healing. And I am definitely there to say, what do you need? How can I help you? And that's what people are looking for. Somebody to listen to their story.
Absolutely.
Really important.
I think this is such an important conversation, more so than ever right now. So thank you so much for your time and sharing.
Thank you. Thank you.
I'd like to add one more thing.
We'll allow it.
The last word, as usual. First of all, thank you, Dr. Lisa. I am so proud to have you as part of my team of people, of experts. Everything you said even reinforced it more. The other thing, and we've talked about this a little bit, is that there's a difference between the art of medicine and the science of medicine.
Yes. Mm-hmm.
And what's important is that Dr. Lisa is an artist. You are. You're
in medicine, you wouldn't say that if you saw my drawings.
Well, I wouldn't say it either, but I try to be an artist in what I do. But it's so different than taking the science and just doing a cookie cutter approach to care.
Right.
And what you do is individualize that care to whatever that person needs. And, you know, I am really blessed to have you as part of our team.
Thank you so much, Jeff. And it's just like Quincy used to do.
Yeah, but that was dead bodies.
But he kept digging till he got the answer, didn't he?
Yeah.
Well, this has been so great. And thank you, Jeff, as always. People can check Jeff out and his work with patient advocacy at caregiverchampionadvocate.com. We'll put the links in this video so people can connect with Dr. Mainier. And thank you both so much. This has been a great conversation.
Thank you. Thank you. Have a great day. Be well.
Take care.
Good to see you.
Bye-bye.